Hi, welcome to the Nisha Jackson Show. I'm Rusty Humphries. That's Nisha. I'm in one of those.
He's in a beauty shop.
That's what it feels like. I'm in kind of one of those "what have I gotten myself into" moments, where I'm a little nervous, but it's Nisha, so it's okay. I'm sure it's going to be great. But we're doing this PRP she's been talking about. We've talked about it for a couple weeks. I'm going bald. I got this male pattern baldness thing, and she showed that basically I'm like the poster child for it, and it's embarrassing. So I said, "Does that stuff really work?" "Yeah, let's do it." And now we're doing it, and it sounds so good. Like, let's just do it. And now we're actually going to do it, and now I'm a little nervous.
You're gonna do good. So this is male PRP, Platelet Rich Plasma. We drew his blood in this wonderful tube right here that has a gel pack in the middle that separates the red blood cells from what I'm going to call the liquid gold, which is the platelets rise to the top. I've drawn all the platelets out into these syringes on the tray here. You can see them all lined up. And we're going to put these syringes of platelets into his scalp in the areas that we know we have the best chance of regrowing hair.
Okay, does this have a good chance of success?
Yes, we're going to get to that in a minute. If you just stop interrupting me.
What are you going to do with my blood, by the way?
Stay on the flow here.
Okay.
The reason why I leave this in the tray on the field here is I like to make sure that I'm actually injecting the right person with the right blood. So this says Rusty Humphries, and we know this is Rusty Humphries, and so we have a good identification. Prior to the show starting, we actually used a triple anesthetic cream to anesthetize the scalp, which really helps when you stick the needle in for it not to hurt. This procedure goes very quick, so it's good because after a while they become a little bit intolerant to the needle sticks in their head, even though they've had numbing cream put on. So this has been on his head for about 20 minutes, which is the minimum amount of time.
I don't feel anything.
Yeah, that's good. We don't want you to feel anything. So the needles are actually loaded with 8 to 9 cc's of platelet-rich plasma, and then you can actually use 0.1 or 0.2 of either bicarb, or you can use lidocaine. For Rusty, I decided to use lidocaine. They actually both work for pain. They're meant to buffer the platelets so that when you buffer them, it means that they hurt less when they go in. So my two choices would be either lidocaine or sodium bicarb, and I picked lidocaine for Rusty.
Because I'm a wussy?
Well, I just wanted that extra little insurance policy, but they actually both work very well.
Okay. And I am a wussy. I am first to admit.
So I want to point out the pattern baldness here. So if Rusty puts his head forward, this is the classic male pattern baldness. There is two areas that come in like this, and it comes to a point. Usually we call this the M, so it looks like an M. Typical male pattern baldness starts with receding on the sides with still some in the middle, and then receding in the back, this area, and eventually this back meets the front, and then this whole part is gone and you just have the sides. So this is very typical male pattern baldness. Once you have lost hair and there's absolutely no hair growth anywhere and it becomes shiny, it's almost impossible to bring the hair back. So if you look here on his scalp, he still has hair growing in this area. So I'm going to inject this whole area right here, which I think will be really good. If this was no hair and it was really shiny, I wouldn't even bother with it. You could if you wanted to, but I don't think it would work very well.
So I'm not too shiny up there.
No, it's not shiny here. And I will do all of these areas because it's very thin. The areas that I don't think are going to work very well is in here. You can see it's shiny. There's no hair growth in here. So I would probably start and do this whole area. He's going to have to keep his little M. But if we can get more hair here and back in here and thicken this up in here, he would feel a lot better about his hair growth. Isn't that right, Rusty?
Yes.
So
but
probably,
the M's not going to be
we're
fixed.
probably not going to fix the M. I'll do part of it at the very tip of the M.
Okay.
So this part is, I'm going to go pretty fast, and what you do is after the syringes are loaded, you have to do this in areas, and 2 people can do it at one time. So I'm going to go ahead and just start about right here, and I'm going to do this whole area to the back, and then I'll come and do this track, and then this track. So that's the way I do it. You can do it this way if you want. The area that's going to be the most uncomfortable for them is the temporal area down here. So I like to just start here, and you're going to push it in, and you do about 0.1. See how it blebs up like that? And you just want to do about every square inch. Just push it in. The scalp's only just a tiny ways away from where you're injecting it. It's just almost the bevel of the needle. You're going to see blood, of course. That's normal.
All the funny jokes have stopped, haven't they?
You okay? Sorry, I know it can be kind of uncomfortable. I try to go as fast as I can.
Yeah.
You don't have to worry about the blood. I actually take the blood and put it back right on the scalp because it has platelets in it also. You all right?
Yeah.
He's had an IV today. So I'm just coming back on my track here. Sometimes the scalp can be really thick too, and what the platelets do, the reason why people lose hair, there's many reasons, but one of the reasons is that the hair follicle with age closes down. And if the hair follicle closes down, what happens is you want to be able to make sure you haven't missed any areas. So this little flat area right here I missed. The other thing that's helpful before I go on to the hair loss causes is to make sure you have enough syringes to actually cover the scalp. So you don't want to run out and only do half their head. So sometimes I knew I had enough to do his whole head. I'm going to lift your head up just a little bit. So I'm coming back up on the other side now. This PRP is done once a month for at least 3 months, sometimes more. You want to make sure you have your needle in all the way into the scalp, otherwise you're going to spray yourself with somebody else's blood, and that wouldn't be really very good. How are you doing, Rusty?
This is awesome. They should do this at Disneyland.
So I'm going to do this other side, just the last round here.
Losing this.
So some of the reasons why people lose hair is they can get yeast in their scalp. And so treating for yeast is something that's really important. You can do that topically.
So does it look like I have yeast up there?
No.
Okay.
But sometimes you can't tell and you just have to treat. We're almost done.
I heard that Tanya did it earlier today on her face, and she's way tougher than me. I feel like a wuss.
You're very sensitive on your head.
I am.
Well, everybody is.
Are they? Okay.
That's why it's really important to go pretty fast with this.
I mean, it's not horrible. I'm just a wuss, so
No.
I'm not.
Well, you are a little sensitive, but this is as you can see, we're making some blood here.
I like this shirt. Don't ruin it.
And so what platelets do is not only do they increase circulation and the healthiness to the scalp, but they open up that hair follicle so you can get new hair growth. All right, so we're done now.
Yeah.
Oh, sorry, we have one more syringe.
Oh,
Just when you thought you were done. I'm going to cover this area a
awesome.
little bit more back here because I know you would like to have more hair back here.
Okay.
Okay. We are done.
All right. Nice job.
You did good.
You're awesome.
All right, so we're going to give the post-operative instructions now.
Okay.
For Rusty and anyone getting platelets, the last thing you want to do is go home and get on Advil because Advil stops the formation of platelets. We actually want the platelets to stay active in the scalp, so no Advil, no aspirin, no anything that is considered an anti-inflammatory we'd want him to stay away from. And that includes any natural anti-inflammatories, curcumin. We don't want him to be on any fish oil or anything else that changes the inflammatory factors of the platelets.
And then
we're going to, he could actually wash his scalp if he wants to now. Some people will just go home and actually leave the platelets right on the scalp and not wash it. I would probably just recommend that, Rusty, that you don't use any shampoo right now.
Tomorrow?
Tomorrow would be good, but maybe not right now. So I'm going to just get you all cleaned up here and get you looking a little bit more presentable and not bloody. And then tomorrow morning would be an okay time to use the shampoo. We have a shampoo and conditioner and a serum that you can use on your scalp to help the hair be healthier, the scalp be healthier, and the hair follicle to be healthier. So I'm going to go ahead and put Rusty on that also. How's the pain?
You know, it's not bad. I mean, it's I don't have a great tolerance for pain, which I'm very embarrassed by, but it's okay now.
But you survived it.
I did.
But you know, part of it's the unknown. So now you know. So I'll have you just take a look at the scalp now. Just put your head down. Really, you can't see anything on the scalp now. There's no bleeding. All of that's gone. And you cleaned up real nice, Rusty. It looks good. All right, so we're going to repeat this again in 30 days.
We are?
And this is the scalp PRP.
It's awesome. Thank you. So it's been about 4 minutes since we finished up the process, and I'm thinking about it. It doesn't hurt that bad. I did have the hair transplants where they took part of my scalp and then they stuck little things in my head. That was way, way, way worse than this. So anyway, you know, we'll see how it looks. I'm sure it's going to get better, but that is something that maybe you should check out. And one of the things you should do is go to nishajackson.com to find out how to do that. nishajackson.com or onepeakmedical.com and see that. Make sure you subscribe to the show. And not all of them will have my blood in it, hopefully. I don't think we're going to have blood in them anymore. But again, I had the transplant 10 years ago. This was way, 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 way better than that. So we'll catch you next time. I'm Rusty Humphries. She's Nisha right there. Show Nisha. And this is the Nisha Jackson Show.